And I think we'll just get right to it. Do I have a motion to approve the minutes from the last meeting?
So moved.
All in favor? Thank you.
Aye.
All opposed? Minutes have been adopted. We've got another action-packed meeting that I hope we can still adhere to. We've got a pretty good record, but I may have just jinxed it. I think we have one of our own, Allie Leonard, right? Presenting today on the Best Youth Initiative update. I'd say welcome, but you're always here, but welcome. Yeah.
Good morning, everyone. Let me switch the slide. There we go. Good morning, everybody. I am excited to share an update with you all on the Best Youth Initiative. If you recall from the last commission meeting, Indiana was selected as one of 5 states that have the opportunity to participate in the Forum for Youth Investments, Building Ecosystems for Statewide Thriving Youth Initiative. Over the next 3 years, we will focus on improving the issue of chronic absenteeism in our school systems, while building stronger relationships and communication across our state departments. This past month, in July, part of Indiana's team joined the other 4 states selected by the Forum in Washington, D.C. for a very productive launch to our project. We were able to spend time workshopping with other groups on their state issues, such as creating a children's cabinet and another who wanted to improve their youth mental health survey. And so this gave our team a chance to share what we've learned through our own progress in those areas here in Indiana, as well as gain valuable feedback from them on our own issue. So the 2 days we spent together were absolutely packed, lots of different activities and presentations. We heard from multiple members of the National Steering Committee, as well as a keynote speaker who happened to be a professional with lived experience. He's worked in various areas of child welfare, including advocacy, as well as for the systems that he was once a constituent of. It was incredibly impactful for me personally to see somebody with a background like myself working towards making the systems that served him better. So one of the activities in our launch was to create a 1-page summary of our state issue on chronic absenteeism, and then we went around the room to leave ideas and questions and concerns on each proposal. This was critical for our team to identify the gaps in our initial approach and thinking, and I think we walked away from that activity feeling more grounded than we started. It was interesting to see other states who were working on different topics than our own, and to meet people from parts of the country that I've not yet been. We noticed in comparison that there were some areas where our state was ahead of others, and we also noticed areas where we could learn from each other's progress to make outcomes better for our own youth. As we continue to look for ways to improve our efforts in uplifting the voices of those with lived experience, we're constantly reminded of the need for dedicated staff person, consistent funding, and constant support to see our work succeed. The most recent commission summer intern, Adriana's primary focus was to connect all of our different boards, committees, and departments to find the gaps where we need to find a center point to coordinate all of our combined efforts. And I think only a few states are willing to pioneer this approach. Iowa is one of them, and they are utilizing the asset of their constituent system knowledge to strengthen communication and ultimately their outcomes. We're excited to host our 2 Forum technical consultants in Indianapolis this upcoming September 23rd through 25th. During their site visit, we plan to take full advantage of their time, and we'll have scheduled interviews and meetings with key interest groups to gather information that will help guide us moving forward. After they leave, they will continue helping us to develop our proposal to actionable steps that we'll build on over the next few months of phase 1. And I just wanted to end my update with, I'm very proud to be a part of this project and this team, and it's already been an incredible privilege to be a part of the commission, but this opportunity to work on an issue that's impacted me has been amazing. So thank you.
Thank you for the update, Allie. And just can I ask a question real quick?
Yes.
Okay. The 1-page summary that you referenced,
Yes.
that's completed?
Yes,
And
so
is that included here or?
No, that is not. It was kind of an overview that we set up with the day out, but those are things that we can circulate out. I think we're looking at where we want to have maybe a sub-page on our website of best youth activities as we get further along, especially with it being a 3-year initiative.
Great. Yeah, thank you. Any other questions? Okay, thank you, Alan. Next up, we've got DCS, presenting on prevention programs. Welcome.
Thank you. I'm Hannah Robinson. I'm the Prevention Services Manager at the Department of Child Services, and my colleague Ashley Purdue is the Prevention Supervisor at the Department of Child Services, and we're going to talk about a few of the prevention programs that we administer and monitor at DCS. The Community Partners for Child Safety Program, or CPCS, the Family Resource Centers, which are now a component of the Community Partners for Child Safety Program, Healthy Families Indiana, and then our involvement in Indiana's My Healthy Baby initiative. So the Community Partners for Child Safety Program is a primary, secondary, and tertiary prevention program. We have administered and funded it since 2006. In 2023, we modified the service standard for the Community Partners program to allow the program to provide primary, secondary, and tertiary prevention, which allowed us to house the Strengthening Indiana Families Family Resource Centers within that service standard. So the Community Partners program, they can serve under the primary prevention component, really any family in the state of Indiana. And then under secondary prevention, it's families with children that are at risk of involvement with child welfare or at risk of involvement with, systems. And they cannot, under the secondary and tertiary prevention, serve any families that are formally involved with child welfare or the juvenile justice system. Also in 2023, we made another modification to the service standard to allow the Community Partners program to serve prenatal families. And we really did that as a response to a need through the My Healthy Baby initiative that we'll touch on a little bit later. We identified that there were, families that didn't meet criteria for the home visiting programs that are involved in My Healthy Baby, or there were capacity issues with some of the programs in various counties. So we modified the Community Partners service standard requirements to allow them to serve families prenatally so that they could serve the families that were that we were unable to serve through My Healthy Baby. The Community Partners, actually, right now we have 5 agencies that provide the Community Partners program within the state, serving all 18 regions. But we actually have the RFP out right now for the Community Partners program for new contracts that will start July 1 of 2025. And those are actually proposals that are due this Friday. So currently the 5 agencies that provide the program in Indiana are Firefly Children and Family Alliance. They serve regions 7, 8, 9, 10, 11, 12, and 14. Geminis, which serves regions 1 and 2, and these are DCS regions. SCAN, which serves regions 3, 4, and 6. Bauer Family Resources, which serves region 5. Firefly, I already said that, sorry. Ireland Home-Based Services that serves regions 13, 15, 16, 17, and 18. And through the Community Partners program in federal fiscal year 23, we served 21,201 families, which included a little over 27,000 Indiana children. The Community Partners program. One of the things that we really like to kind of tote about the program is the program's flexibility. 70% of the funding to support the program is to be used specifically for the Community Partners Program, but 30% of the funding that's allocated for each region can be used flexibly to support other prevention initiatives within the community. I kind of referenced this before as far as the top target population, but for the primary prevention component of the service standard, it's really available to all caregivers and families. And there's no eligibility criteria for that. But for secondary and tertiary prevention, these are services that are for at-risk families or families that have had previous involvement with the child welfare system. And by engaging in the program, it may, prevent them from reentry into child welfare. We do make some exceptions occasionally for youth that are, turning 18 and are still in care, because right now the Community Partners Program is, serves families with children. And, if we have a youth that's 18 years old and is still involved in like post-secondary education program, we do allow them to provide services to those youth through an exception. And like I said earlier, we now allow them to serve prenatal families, regardless of whether they have other children. And that historically was not the case. They had to have other children if they were pregnant to be involved with Community Partners. Evidence-based models that, sorry, I skipped ahead too fast. The program uses, they basically provide programming within the region, based on the region's needs. But when they're providing direct services to families, they use a lot of evidence-based models, including parents as teachers, motivational interviewing, strengthening families, common sense parenting, 1, 2, 3 magic, and the nurturing parent curriculum. One of the also benefits of this program in our state is they have the ability to provide concrete assistance to families, which is really helpful in meeting families' needs and keeping them from becoming involved in systems unnecessarily just because they have, a need for housing assistance or concrete assistance in some form, paying a heat bill to, heat their home, or providing lice kits or, things like that. And the Community Partners Program has the ability to provide a wide variety of concrete assistance based on whatever the family needs. This kind of highlights a little bit about the, services that they provide. The Community Partners liaisons provide in-home visitation, and help families develop goals, and then connect them with local community services or resources that are available in the community. They also, provide some service coordination, and advocate for families. And the last, this slide is outdated. It's actually the 2023 federal fiscal year. The most kind of identified needs for families were related to things like needing help with finding housing, with support for rent and utilities, needing information on budgeting, and counseling, as well as helping with children's behaviors. There's a link in the PowerPoint presentation that takes you to our Community Partners provider map, which provides referral information and contact information for each of the 5 Community Partners agencies for each region of our state. So I referenced earlier that in 2023, we modified our service standard to allow for primary prevention to be provided within the program. And that allowed us to add the Strengthening Indiana Family Resource Centers within the Community Partners standard. So prior to 2023, we had established 4 family resource centers through a federal grant, the Community Collaborations Grant. Those first 4 centers were in Madison, Grant, Timpton, and Delaware counties. And as of July 1 of this year, DCS has taken over funding for those 4 initial centers. In 2023, we funded the expansion of the Family Resource Centers to add 5 additional centers in the state. And we wanted to kind of look at a lot of different data to identify where those 5 should go, but we also wanted them to be within each of the community partners, contracted agencies like catchment area, so that all 5 of the agencies would learn together through the implementation process of the Family Resource Centers. So we looked at county demographics, poverty indicators, health indicators, mortality indicators, child abuse and neglect related fatalities in each county or region, the current agency that's providing the community partner services in that region, data related to criminal and juvenile justice involvement, as well as looking at where existing resources already exist and opportunities to collaborate with other community agencies were already present, as well as like readiness to receive a center or support a center within that community. And we ended up landing on Wayne County for Fireflies region, LaPorte County for Geminus's region, Tippecanoe County for Bowers region, Elkhart County for Scans area, and Clark County for Ireland's area. I'm going to take a drink real quick because my mouth is getting really dry. What is a Family Resource Center? So we have a couple of definitions up here that we like to use. That's a one-stop shop or a safe place for families to go to receive concrete support, social connections, connection to resources and other needed services, and a family-friendly Family Resource Center uses the protective factors to strengthen families, develop goals, and keep kids and families safe. We also like Colorado's definition that defines a Family Resource Center as a unified single point of entry where vulnerable families, individuals, children, and youth in communities can obtain information, assessment of needs, and referral and delivery to family services. And we also like that a Family Resource Center is a place for families to seek help without stigma or involvement from child welfare or legal systems, a place that normalizes asking for help. So the Family Resource Centers can look very different, and we really want them to look very different based on the needs in each individual community. So one of the things that we did when we were kind of working to identify where Family Resource Centers would be housed, we looked at a lot of other states that have established Family Resource Centers to see where they were housed. And one of the states that we visited was Kentucky, our neighbor, and a lot of really all of their Family Resource Centers are located in schools. They have them accessible in elementary schools. They put them in places where families already go. We were not successful in getting any of our first 5 in the expansion group in schools, though we did make a lot of effort to try and get one in a school. But we weren't successful with that. So that's something that we still would like to pursue because we really liked Kentucky's model and feel like, putting them in a place where families are already going, helps to, one, promote, kindergarten readiness if they are accessible for preschool and, families that are entering, just have children that are just starting to be school age, as well as having them in high school helps to promote, independence with youth and prepare them for being adults. It also increases the graduation rate, or has been successful in doing so in Kentucky. We also looked at already existing community centers or service hubs or places where families already can go to receive like co-located services. And we also got some information from some other states that have centers that are more mobile. You know, they kind of travel around within the region. They set up shop at existing locations and provide services like certain days of the week. So some of the things that you could expect to see at one of Indiana's family resource centers are, you know, comprehensive family support case management. There will be, you know, somebody there to help families kind of navigate resources, provide that case management service at all of our centers. You'll also see what we call a Susie store, named after Susie Mariscal, who was the project director of the Community Collaborations Grant, which established the first 4 centers. And those look a little bit different based on the community needs. Some of them are set up kind of like food pantries where you can, families can go and get like take and make meals, or, you know, all the supplies that they need to make a meal. In other counties where they have several food pantries, they're more set up for like clothing and hygiene items and that kind of thing. So they're really set up based on the needs in the community. Some of them are attached to like child care centers, or so they have access to early childhood education. All of them typically have a computer lab or a means to help families, you know, like create resumes or, you know, apply for employment if that's something that, you know, they're working on as a goal. And then there are, you know, several other kind of items on this list that you could expect to see at any of our Indiana family resource centers. Does anybody have any questions related to community partners in the family resource centers before I have Ashley come up and talk about Healthy Families and our involvement with My Healthy Baby?
Hannah, thank you for sharing all that. And actually, those that may not remember, about 5-6 years ago, we created a legislation that had a pilot program for 4 of these centers. And we went and visited them with Julie Whitman, who was our director at that time here at the commission. And I was excited. Actually, yesterday I went and toured one of the Firefly facilities here in town, and we talked quite a bit about the resource centers and how successful they are. I'd like to get more data on that success, but I'd like to see also how great is the need for more of these. So you've got 19 regions, right?
We have 18 regions, DCS regions, and right now we have 9 total family resource centers, which are, I think, in 7 regions of the state, if I have that correct in my mind. I feel like at this point, we don't have enough data to know from the expansion if there is a need for more. We just started collecting data for the additional 5. Kind of last year was the implementation phase for the expansion centers, and we started collecting data related to families served. I mean, really early in 2024, but with the requirement of specific data collection didn't start until July 1 with some, you know, service standard changes, which set expectations for the data that should be collected by all the family resource centers. So we have very limited information at this point related to the additional 5. I can share, I don't have it with me today, but I can email Mark and he can send it out to the group after today. We can send kind of the impact profile for the 4, because that grant just wrapped up. And so that would give you an idea of how effective the first 4 centers were. We also did some, you know, evaluation and comparisons of the counties where the first 4 centers were, and looked at reduction in involvement in child welfare that occurred in those 3 counties. But we also had some other initiatives that went into place around the same time. So it's hard to nail down whether that reduction is specifically related to the family resource centers or another community-based program, the Indiana Family Preservation Services, that kind of went live or rolled out in 2020 at the same time as the first 4 pilot centers. So it's kind of hard to determine what caused that and if it was related to the family resource centers. But we We definitely feel like they are beneficial. I know all of the community partners agencies would love to add more centers. They definitely seem more families engage in events and activities that they have at the centers than what they were seeing before and just doing community events kind of under the community partners program name. So it is definitely seen in the community as a more stigma-free environment and a safe place to go to get help or to just engage with your family and enjoy time with your family.
I guess I could talk a lot about
Yeah.
this, so I'd love to, but, and then maybe we could do a deeper dive or a tighter network group to look at it. But I know Kentucky, right, so they're in the schools, so they're in the communities already, but and the issues that I was hearing is that they're dealing with the kids, not so much the parents, right? And so when typically schools, your kindergartner, but a lot of these family resource needs are usually done in early education and kindergarten type stuff. So it might not be, to help the single mom that's got a 1-year-old or a 2-year-old, right, type of community where she's not in the schools yet with the kids. So it's just something I guess I would be a little concerned about. And the other factor I'd love to talk a little bit more on is, so we're about to study the fatal reviews here in Indiana. And maybe we could do a deeper dive, like maybe a 5-year overview of if there's a concentrated area of fatal problems in our state, can we concentrate on those areas, right? That there seems to be a bigger number of fatal reviews going on.
And that's definitely one of the data points that we looked at to help us determine where to put these next 5. And we are currently funding the Family Resource Centers through a federal grant, the Community-Based Child Abuse Prevention Grant that DCS is the state agency for. And right now, we do not have any additional funding to expand to fund any more resource centers. So it's definitely something that
We
we're
might be able to
interested in.
tap into the Eli grants that are out there. And I know Julie Whitman is with Eli Lilly now, so it might be a good person to at least to have a discussion with.
And that is definitely something that is being discussed. One of the things that we've encouraged all of the community partners agencies to do is we really want the Family Resource Centers to be supported, not just by DCS, but also by the community. And some of the things that we've been offering for the centers is, providing education on, grant writing, helping them to identify funding opportunities that are available at the local level or at the state level or at the federal level that they can apply for to help them to expand. This year, we are one of our goals through our prevention team is to establish an association for the Family Resource Center so that we can allow centers that may not be funded by DCS to join and have the same kind of expectations as the centers that we are funding, and also receive, training and technical assistance and support from the association with, things like implementation and, any challenges that they're having with the community, as well as help them to identify and support them in, exploring other funding opportunities. And I have heard there's some interest from Lilly regarding supporting the Family Resource Centers. We also, through the Early Years Initiative, we really encouraged all of the agencies to explore, the application for that, especially if they were, partnered with a child care center or, other community programming that, serves children, 0 to 3 years. So.
Thank you very much.
Hannah, sorry. As a resident of Wayne County, I can say firsthand, Firefly did a really nice job as they were looking at the services and what the model looked like in Wayne County. So very engaging with us and juvenile justice and DCS and our school partners. And they have really done a nice job as they've come into the county and served those in most need.
That's great to hear. And what we did, because Firefly was the implementing agency for the first 4 centers, we contracted with them to provide technical assistance to the other 4 agencies to help them with implementation. So they kind of paved the way, and then they all implemented through the expansion together with, Jill Kelly of Firefly really leading the and supporting the other 4 agencies and kind of identifying who should be on local implementation teams and, determining what services should be, available at each center, identifying where they should be located. And so that has been something that's been really beneficial is, allowing them to learn together and to learn from somebody who's already implemented 4 and now 5 in the state.
Bernice. Oh, sorry, this interjects.
I have 2 questions. Rep. Devon kind of started down the path of what I was going to ask. In some of your slides, you identified high family needs that were discovered. One of them was rent and another was utilities. Can these family resource centers help families with those types of needs?
What typically happens, because all of these centers are also our community partners for child safety programs, is if the family needs, has some significant needs or needs assistance with kind of more expensive concrete assistance, they would then refer that family to receive case management services from the liaison. And so, yes, I mean, in a roundabout way, yes, they would be able to receive assistance with those concrete assistance needs. I did bring some other data just to give you an idea of some of the other needs that we see a lot from the Community Partners Program. And, we will have this data, I would say, within a year specifically related to the Family Resource Centers. But transportation is a huge need still within our state. Childcare is a huge need. Children behavior concerns, mental health needs for both children and adults, assisting families who have a disabled child, as well as, things like job training and job seeking. We have, had kind of a huge need. But
Can I hop in there and ask my second question?
You
Because
sure
you're kind of going
can.
down that line too. So I'm reading from the 2022 Child Fatality Report, and this is on page 3. It's the last sentence. It says, in some cases, caregiver stressors were determined to play a role in the death of a child. The rates of disability or chronic illness, history of child maltreatment was as a victim, substance use disorder, unemployment, insufficient income, all increased in 2022 among caregivers involved in child deaths compared to 2021. I know you went down some of the issues that families are facing, but can these family centers offer direct support to relieve those types of stressors, to change families' day-to-day stressors that they're living with?
they can. I mean, they provide kind of a safe place for families to be together. They do a lot of, family fun activities or events. They also can work with a mother or a father individually while providing some, an activity for the child to do so that kind of they get a break, I guess, from their child. They all have kind of a kid's corner, so to speak, that provides, like puzzles and activities and things like that with staff to, be able to kind of entertain the children while caregivers are getting, support with any needs that they may have, whether that's, connection to a service like, counseling or therapy, or whether that's, creating some goals or working through, creating a resume and applying for jobs. So there is that support there to, provide families with a space that can also, accommodate their kids while they're getting assistance with whatever needs that they have.
Senator?
Thank you, Mr. Chairman. So I have two questions. Are the family resource centers considered nonprofits?
I think so. I think they're all a separate 501c3.
Okay. So back to Representative Devon's line of questioning he was asking. Lilly Endowment right now has a $600 million grant for Marion County, just Marion County alone. So it wouldn't help the other counties for the family resource centers, but it could help those that are in Marion County. So if they created a collaboration and partnership with some of the schools that they are near, and it would address some of these disparities, they could apply for that $600 million, write a grant for that. You may want to look at that, maybe call a meeting, look into it first, call a meeting with some of your family resource centers, identify those schools that they already, students they're serving, and identify how they can connect with the schools, and have a meeting and talk about how they can apply for that funding if they're already serving those students around what the work, like Bernice just said, what they already are doing, and not reinventing the wheel for the services they provide. That's just a recommendation.
I appreciate that.
Thank you.
Senator?
I don't know which one of us
Yeah.
raised our hand first. You did, okay. Thank you, Hannah, for this presentation. It's fabulous, and I appreciate the information. Back on slide 11, you were talking about the services that would extend and have an exception to the 18-year-olds as long as they were still in the education system. If they are chronically absent, are they still eligible for those services? Or if they've gone on to truancy, are they still eligible for those services?
Yes.
Okay, thank you.
We just review those individually, and Ashley might be able to talk a little bit about that because she actually reviews and approves all of those, what we call like exception requests. But we get, I mean, I don't want to say a lot of them, but we are starting to see more of those requests to serve youth that are, not involved with DCS. If they're formally involved in juvenile justice, that's a little bit different, but we have been acting as a liaison to, identify additional needs that youth may have that may be able to be met through, the providers that are serving them through juvenile justice involvement. So like I said, she may be able to talk a little bit more about examples that we've had, but I know that we have been, approving at least a handful. I mean, we don't get that many for youth that are still in high school, don't have any children of their own, but they're not living with their caregivers and need a lot of support.
You had mentioned earlier about youth or family members that were a part of the system, the justice system. Is that disqualify the whole family or just that individual?
The criminal justice system is not a disqualifier in any way. The child welfare or juvenile justice system. So we look at those individually as well. So if we have a family that has, one child that's involved with child welfare, but they have 3 other kids in their home that are not involved in that case, then we absolutely can make an exception to allow community partners to serve that family. But we also understand that families that are involved in child welfare and juvenile justice are already receiving community-based services that hopefully are able to meet those needs that they have. So we kind of look at those on a case-by-case basis to make sure that it's necessary before we approve them. And whenever possible, we communicate with the, the child welfare agency or the probation office that's involved with the youth so that we can help kind of make suggestions for services that we know that they need that they may not be getting through their involvement with those systems.
Thank you.
I know that the group would probably be interested in just a corresponding map of the regions and where the community centers, the 4 and then the 5 are as well. I think that would be helpful.
And we
just
would be
sort of
happy to come
visualize
back.
it. I know for me.
We'd be happy to come back. We would also be happy to have one of the actual agencies, because they could talk more about what they're seeing day to day.
Yeah,
if
I
you'd
think it'd be
like that.
good, and maybe to understand the different scope of services that exist in these different places. Obviously, I think it mentions here as a disclaimer, none of them are alike, but it would be kind of interesting to know what services they're sort of emphasizing in these different areas. I had one other question, then I'll go to Dr.
I would like the contacts for these facilities as well as we're working out in the counties across the state. I know that our local health departments are looking to help supplement similar services, and so I'd love to be able to make that connection.
So one of the slides in there is a link to our Strengthening Indiana Families website. And there is a page for each of the centers. So that would, and I can send that to you as well if you want. I can send it and you can send it out when you, or put it in the meeting minutes. But there is a page for each of the 9 centers. It would outlines like what their calendar of activities for each month, may reference some partnerships that they have with the community, but that would be a good kind of place to explore contact information and addresses and all of that's on the website.
And can I ask one other question? The child abuse grant that you mentioned, is that it's a recurring federal grant?
Yes.
And so just thinking about that, making sure we don't have a cliff there, this is going to be something that's going to be perpetually sort of earmarked for this purpose. And has that grant gone up in past years, or?
It definitely went up during the pandemic. We
Yeah.
saw a pretty significant increase, and they've actually been able to maintain a bit of that increase since 2020. So we got kind of a significant increase during the pandemic, and then we typically received about, it was pretty small, an $800,000 a year prior to COVID. And then we got a supplemental grant that was about a little over 2.5 million in 2020 because of COVID. And then we haven't gotten our award yet for this year, but it has been maintained at about 1.9 million since.
Will you feel comfortable we can sustain the same level of funding for the 9 centers moving forward? I guess that's the.
I do, and I also feel like now that we have implemented, because we had, the implementation phase is the most expensive, I would say, hiring staff, finding buildings, getting familiar with what your operating costs are going to be for the year. And there, we've maintained the allocation for each of the centers as the same, even though the implementation phase is now over. And so that may allow them the opportunity to add some satellites or, even pursue another family resource center within their region if they're able to do that within their allocation for the family resource center.
And the allocation for a family resource center is?
$275,000 a year.
Thank you. Any other questions, comments? Thank you very much. We probably could be here for a while on this one. So
No problem.
this happens in our group, but it's a credit to the topic and the testimony. So thank you. All right, next we have Dr. Yoder.
Oh,
wait, no.
we still have another part.
Yeah.
Sorry.
Oh, sorry.
I'm Ashley. I'm Hannah's coworker. I'm the prevention supervisor on the prevention team. And I'm going to talk to you a little bit about Healthy Families, which is the DCS Prevention Home Visiting Program. We actually celebrated 30 years of Healthy Families in Indiana this year. And it is a statewide program, so it's in all 92 counties. So research over the last 2 decades has consistently confirmed providing education and support services to parents around the time of a baby's birth and continuing for months or years afterwards significantly reduces the risk of child maltreatment and contributes to positive, healthy child-rearing practices. Families receiving this type of intensive home visitor service also show other positive changes, such as consistent use of preventative health services, increased high school completion rates, higher employment rates, lower welfare use, and fewer pregnancies. And there's more information about that research on the Healthy Families America website. And it's a successful program here in Indiana. In 2023, Healthy Families served 10,953 families across the state. Some of the eligibility for Healthy Families services It's a prenatal and postnatal program. Families have to enroll prior to the child reaching 3 months of age. There's some wiggle room on that because the model requires a certain percentage be enrolled by that time, but depending on the amount of families you serve, you are able to enroll a little bit past that if necessary. In Indiana, we have a little bit different eligibility for the program than other states. We have a 8-item screen that just kind of helps us determine, and it's a validated screen that helps determine whether a family will assess or score high on the FROG assessment, and FROG stands for Family Resilience and Opportunities for Growth scale. It's the assessment was created by HFA, and we also use that for determining eligibility. So you have to score positive on the 8-item screen and then score a 10 or higher on the FROG to be eligible for those services. The FROG scale looks at things like social and emotional competence, perception of the child, knowledge of infant and child development, parental resilience, plans for discipline, current or previous CPS involvement, whether as a parent or a child, childhood experiences, behavior and mental health, and other stressors. Families also must not have any current formal involvement with DCS, with the exception of pregnant or parenting teens. We actually require a referral to home visiting for all pregnant and parenting teens involved with DCS. And then we work with what we consider, or what we call a target child, but it is a family service. So while there's a target child, we're still providing services to the whole family. And there could be additional criteria required for specific funding sources too. Like to be 4E eligible funding, the child has to be born, but that's not necessarily like eligibility requirement. So some of the goals in our target population. So goals and target population. Our target population is pregnant women in the 3rd trimester or within 2 weeks after birth. We provide services up to 3 years past enrollment. We actually have to provide, as part of the model, services up to 3 years post enrollment. But some of our sites can provide or do provide services until the child's 5th birthday. Our main referrals come from WIC, My Healthy Baby, which I'll talk about in a second, health clinics, hospitals, and sometimes we get referrals from DCS as well. The goals are to engage families with multiple stressors, promote safe environments for children, cultivate and strengthen nurturing parent-child relationships, promote child growth and development, enhance family functioning, and then we also provide staff training and support for professional well-being as well. The overall goal of, or the model of Healthy Families is to promote that parent-child interaction. They're also consistently screening for interpersonal violence risks, depression, developmental delays, with kids and subsequent children born as part of the model as well. And so what we have found through the last 30 years, we look at data and compare it with our CPS data through match reporting. And what we have found is that families who fully engage in Healthy Family Services, which we consider fully engaged, 12 home visits, which is about 3 months of services on average. 99% of those families that are fully engaged in Healthy Family Services end up with no formal involvement with child welfare. So it's pretty successful here. Now I'm going to talk about the My Healthy Baby initiative. Some of you may know about this already, but it was created in 2019 as a response to the rising infant mortality rate in Indiana. And it's a partnership between IDOH, DCS, and FSSA to connect new and expected mothers to home visiting programs in the state. As of May of last year, it was statewide. So My Healthy Baby works as a referral system, and it's one of the main referrals for healthy families because we are one of the statewide home visiting programs. But it's to connect families with already existing home visiting programs, including Nurse Family Partnership, Healthy Families, Early Head Start, or other like homegrown home visiting programs. My Healthy Baby will receive the referral, and then that gets sent to the IDOH Moms Helpline, and call support specialists then reach out to the family to determine their interest in participating in one of the programs. If the family then gives consent to accept a referral, then My Healthy Baby connects them to the best fitting program in the area, typically based on eligibility. So like anyone who's eligible for NFP, that family will go to NFP, and then the rest are split up between the other home visiting programs in the area that they're eligible for based on algorithms that were created. They also access other resources for the family and connect them to those as well. And then they'll follow up to ensure that that connection is made. So that's been a really great referral source for healthy families over the past few years. It's really easy to get connected. There's some really great videos on the My Healthy Baby website as well that talk about, it's like families who have participated in home visiting, sharing their success with it and how much they appreciated their home visitor. I highly recommend you guys looking at those. They're amazing. So referrals are easy to make. Providers can make them. They can be a self-referral. Hospitals can make them. Anybody can go there and make that referral for the family. And while the goal of My Healthy Baby is to connect families to a long-term home visiting program, as Hannah had talked about earlier, we updated the CPCS service standards to include prenatal families because we noticed a gap in services, whether that was due to the capacity of the programs or the family not qualifying for a home visiting service, but still having high needs. So we opened up the service standards to allow referrals to community partners to try and fill that gap. And that is all of our prevention programming that we're going to talk about today. Here's the contact information for our team. Does anybody have any questions on Healthy Families or My Healthy Baby? Awesome.
Thank you. Now we've got Dr. Yoder. Welcome. Sorry, it's premature in your introduction.
Thank you. Good morning. Thank you so much for having me here today. I'm Rachel Yoder. I'm a child and adolescent psychiatrist with Riley Hospital for Children. I also co-direct and serve as a consultant for the Indiana Behavioral Health Access Program for Youth, or which we optimistically call Be Happy. I was honored to be able to share information about our program to this commission in June of 2022, and I'm so grateful to be able to be here again to provide an update on our progress and talk about next steps. Maybe I'll have you refer to your papers. So what's Be Happy? Be Happy is a phone consultation line in which any primary care provider in Indiana who takes care of children and adolescents can call and speak with a child psychiatrist. These are pediatricians, nurse practitioners, family medicine physicians, social workers, and others. And when they call, we talk through the concern, help them find resources, and if it makes sense, walk them through the beginning and ongoing stages of treatment. For the past 2 years, we've also been able to offer virtual therapy, and we have monthly educational sessions for providers where we get about 50 Hoosier providers attending each session. Be Happy began in 2019 with support from the Indiana Division of Mental Health and Addiction. In 2021, we received a 5-year federal grant through the Health Resources and Services Administration, which is administered through the DMHA. This grant expires in September 2026. I know all members of this commission are acutely aware of Indiana's mental health services need. And I know you heard about the Youth Risk Behavior Survey at the last meeting, and I appreciate the tough work you do and the fatality reviews. We're still among the lowest states in rankings for child psychiatrists per capita. And we have similar workforce challenges with all mental health providers. We also know that catching and treating mental health concerns early can prevent worsening, and that most families first seek out mental health care and often hope to continue it through their primary care provider who they know, who's relatively easily accessible to them, and who's frankly not a psychiatrist. These Hoosier primary care providers are excellent. They work hard for their patients. We've been asking a lot of them in the setting of mental health workforce challenges. We also know that only, for example, 1 in 3 pediatricians report sufficient training. Here we go, thank you. To diagnose and treat mental illness. So these primary care providers, they want to help their patients. They want to make sure they do it safely and following the most evidence-based guidelines. Before they had the ability to call Be Happy, they had a tough choice when patients came to them seeking help. They could start a treatment plan they were a little unsure of, they weren't sure if it was quite up to date, or they could just refer, but that often meant long wait lists and when symptoms were worsening over many months. With Be Happy, these pediatricians, these primary care providers can get immediate evidence-based treatment guidance. We also assist with finding local resources, and we support their holistic treatment approach. When these mental health concerns are addressed in a timely manner, many patients improve, allowing their whole course of care to remain with their primary care provider. At the same time, there are certainly patients who absolutely need to be seen by a specialty mental health provider. And for these patients, Be Happy is able to support them to safely bridge care until they get off that wait list, until they get into that office. So this work, in effect, expands our state's mental health workforce because it enhances the mental health care capacity of providers who are already accessible to these patients and with whom they're often most comfortable. We're really proud, a little delayed here, in the feedback Be Happy gets from our providers. We frequently see words like life-saving and lifeline, and I'm most excited that it's clear that the outcomes of these calls extend beyond individual calls as providers report using what they've learned with other similar patients and sharing what they've learned with their colleagues. Be Happy is one of almost 50 similar pediatric mental health care access programs throughout the US. And there's growing national data that aligns with what we hear from Hoosier providers who use Be Happy. They like this program. They feel more confident providing mental health care when they have this program as a backup. And what is also, I think, so important is that more screening occurs in places where programs like Be Happy are available. This means concerns are caught and addressed earlier. PCPs using these programs report seeing their patient improvements, and there's also a large body of evidence growing that these programs are cost effective, which makes sense. When mental health concerns are caught and addressed earlier, patients can get better and avoid what we're always trying to avoid, the need for emergency and hospital-based care, which is also, we know, more expensive. When I spoke with this commission 2 years ago, we had 658 providers enrolled, and we completed 1,431 consultation calls for patients in 62 counties. Since then, we've worked quite a bit on outreach, and we've also started using heat maps as visuals. As of earlier this month, we've helped 972 providers, we've completed over 3,000 calls, and we've guided evidence-based mental health care for children in 87 of our 92 counties. To be clear, it's available, we just haven't heard from providers in those remaining 5 counties yet. I think looking at this map, you see higher use, both where we expect it based on population, like your Evansville, your Fort Wayne, Indianapolis, and surrounding areas. But we also see a lot in rural areas, that major south, central, east region. And I think it reflects both lack of access in those rural areas, which we know, and also may reflect just an ease, a preference to remaining getting your mental health care with your primary care provider. In 2022, another of our goals was to get this help for adults. And, this certainly aligns with the Commission's 2 generations goals. And I'm so excited to share that in 2023, an adult version of Be Happy was developed. The Indiana Consultation for Healthcare Providers in Addiction, Mental Health, and Perinatal Psychiatry, or CHAMP. CHAMP is currently funded by the DMHA through June of 2025. 2 years ago, we also had just received additional grant support for direct teletherapy services, and we're getting to hire therapists. And since then, the Be Happy Therapy program has cared for 277 patients. We've also, in the past 2 years, applied for and attained additional federal grants, which have allowed us to do work supporting emergency departments and increasing those trained in therapy focused on suicide prevention. I think Hoosier primary care providers continue to share with us how important this program is for them and their patients, and how its benefits extend beyond individual phone calls. And now here's an ask. I shared the federal grant support September 2026. I think so based on the legislative calendar, I'm sure you all are more aware than me, it seems like the 2025 session is our last chance for a state legislative solution. And if there isn't one, we think Be Happy will be available, but likely only through IU health related organizations. And so those are those sad little 8 counties would be who we could serve. Other states with programs like this are also working on sustainable solutions. Some have been able to achieve funding through just kind of a straightforward state budget item. Another mechanism that some states have and others are considering is a pooled insurance funding model, which kind of proportionally, it says insurance companies who operate in the state and cover, say insurance company Z covers 10% of the state, then that insurance company Z would contribute to about 10% of the program. And when it's shared, it actually ends up being a pretty small portion of any insurance company's budget. And I think most understand the value of this preventive care that is cheaper than more expensive care that could happen. We are also obviously open to any and all ideas others may have. Because Be Happy has such an impact on expanding our mental health workforce and gaining access to evidence-based mental health care for our young Hoosiers, I hope the Children's Commission will strongly consider ongoing support. Thanks so much for having me. I'm happy to answer questions.
Dr. Weaver? No, just open it up for questions.
Well, thank you so much, Dr. Weaver, for being here. So the last time we talked about this amazing program, one of the things that you mentioned was that the clinicians are getting educated on how to care for these kiddos with mental health problems. And so maybe they are calling about pretty basic things, and then they can do it. They have the confidence to continue to care for more kids, which decreases the need for referrals, because it's going to be, if ever, decades before we have the mental health providers to be able to care for all these children. So we need our primary care providers to understand. But you also shared, so now the calls are getting more complicated, right? Yeah, so I just maybe expand on that a little bit. And I think because I am not big into how this all works, for the lay people in the room, the problem is that this is a clinician to a clinician call, and there's no way to bill for that, right? So unless we make a way to bill for that. So that's why it requires grant funding to be able to provide this level of support. And I would say you could There's other things that have come up, pediatric dermatology, other opportunities where, again, how do we enhance and enable our primary care providers in our rural communities to be able to care for things with just that clinician-to-clinician support? So anyway, if you maybe kind of expand on a couple of those issues.
Yeah, absolutely. Thank you for bringing those up. And I do, so I've been answering these calls for the past 5 years, and I've seen kind of anecdotally in the first couple of years, these are very easy calls. I'm like, okay, this is your first step here. And now in the last couple of years, I get a little bit more nervous when I'm called, because I'm like, oh, this is going to be a tough call. We're going to have to go through multiple steps and multiple if-thens, and then think about resources in maybe a more creative way than we have. And so we do see, I think, a lot of learning, I think, and we are seeing like providers who called a lot frequently in the first couple of years are calling more infrequently, maybe a couple of months for a more complex patient. But your point is right. I think we still have a lot of providers in the state, and we actually are graduating pediatricians who still don't have, I think in 2026, they will be first given a month of required mental health concerns. So we're still not quite up there, and we probably, like you said, won't be in a while.
The only other thing I wanted to add, just to put some data, for example, behind the CHAMP program, is that we surveyed our birthing centers, our perinatal levels of care, and specifically asked them, are you screening for substance use issues, right, for addiction problems? And many of them, one, are not, and two, if they are, the follow-up question is, well, did you refer or did you address it? And the answer was overwhelmingly no, because they didn't know how to, they didn't know who to connect to. And so I think your point made is that you're seeing increased screening is because, clinicians, providers they don't want to take that step of even asking the question because they don't know what to do with the answer. So if we put these tools in the hands of our clinicians across the state, they're going to be more likely to screen, and then they're going to know what that next step is, to do something to address it for the perinatal or postnatal, and then also for these kiddos. So thank you again.
Any other questions? Thank you very much,
All right,
Dr.
thank you
Bieder.
very much.
Sorry. Guess we're here, Commissioner, aren't we? Okay, back at it. Who do we have next? Ray Keller, I think. Next, right? CASA, Guardians Ad Life.
All right.
Welcome.
Excuse me. Good morning. Thank you to Mark for asking me to be here, and thank you to the Commission for having me. My name is Ray Feller. I'm the State Director of GAL CASA. Just a little bit about me. I've been practicing law around the juvenile world since 2007, and I have been with the state office since 2021. So jump right in here. Okay, so what I'm going to be talking about today is a project that I am proposing internally within my office. I happened to run into Mark in the hallway. We talked a little bit about that, and this is something that he thought that the commission might be interested in hearing about. So I thought I'd come talk to you about it today. So just to start with just a little bit of background about our office in CASA, and I know for some of you, I do apologize, I know that you know this, but our office was established in 1990. We are housed within the Indiana Supreme Court, and what the state office does is we work locally, we work with our local programs, and we certify and train our local programs. We ensure that they comply with our standards and our code of ethics. We don't do any litigating at the state office. We don't get involved in any cases. Don't do anything like that because cases could end up before the Supreme Court, and that would be a big problem. So we don't do any cases ourselves, but we do try to help out and make sure that our local programs are doing what they need to be doing. Went the wrong way. Oh, there we go. So for our local programs, we have local programs in 87 of our 92 counties, and I have the map here. You can see where the 5 programs, or the 5 counties where we do not have programs. And our programs, just like anything else that you're going to hear about the state, look different depending on where you're at in the state. And they consist of directors, staff, volunteers, Staff can be supervisors. We have attorneys in our programs, trainers, recruiters, advocates, just depending on where you're at. And we at the state office really try to tailor our training and our programming to fit each program. And that is all the way from a program that is advocating for 4,000 children in a year to a county that's advocating for 4 children in a year. So we try to do the best that we can to suit everybody's needs. So you'll hear GAL CASA, and you're thinking, who are these people? Well, these people have to be 21 years and older. These people are interviewed and screened. Believe it or not, these are volunteers, but we don't just let anybody be a CASA. We say it's a privilege to volunteer. It is not a right. So they go through an application process. They have to pass a criminal background check. They pass a DCS background check, and then they go through 30 hours of initial training. I think that's pretty intense. It's a big ask. Then they have to do 12 hours of ongoing training every year. They're trained in the identification and treatment of child abuse and neglect, and in early childhood, child and adolescent development. And the biggest thing we tell them is have time. Now, obviously, this doesn't apply to our staff advocates, and we do have staff advocates. They do have the time because they're employed, but these are who these people are. Our people are, I say CASA people are the best people. They truly are. These are your community members. These are the people that care about the kids in your community, and they want to make the community a better place. So when I was putting this presentation together, I was putting in all this data and these numbers and trying to tell you about, like, this is how many kids we advocated for and the real wow factor. And, you know, I don't know if it really comes across like it should. These are the things that matter. The person that has known me longer than anyone else. These are real quotes. The one in the red, this was from last week. I went to a fundraiser and a kid said this, got up and said this. I shouldn't say kid, this young woman got up and said this in front of a big group of people. The first time in my life that I felt like I had my person. And the room was in tears. That's what we do. That's what CASA is. We're the first time a kid felt like she had her person in her life. Ooh, I pushed too hard there. So this slide, I had people in my office look at this slide and everybody said, Ray, I don't know what this slide means. It's confusing. Well, then good, I made my point. GAL, CASA, what does that mean? How is it different? How is it the same? The takeaway is, if you hear GAL or you hear CASA and we're talking about child welfare, it's the same thing. It means an advocate that is advocating for the child's best interest. What you need to know about that is we're a party to the case. So if it's a CHINS or a TPR, GAL CASA is a party. They are advocating for interventions and services for a child to get that case closed and get that child into a home that is safe, stable, and permanent as soon as possible. So GAL, CASA, interchangeable. Doesn't matter which one you're calling it. Sometimes it's a volunteer, sometimes it's a staff person, it could be an attorney, doesn't matter. GAL, CASA, best interest advocate is what that means. That's the takeaway. So this is the national model. And these are all the things that go into the national model. Learn, engage, recommend, collaborate, report. And this applies across the nation. When you hear best interest advocate, these are the things that you're going to hear that apply. So I wanted to show you that. I mean, this is kind of the universal. This is from National CASA. This is the universal best interest advocate. What we say on the state level is this slide. So conduct an independent investigation, and we mean independent. We are not a rubber stamp for DCS. We are not a rubber stamp for mom and dad. We're not a rubber stamp for foster parents. If you hear somebody complain to you that I'm the best interest for this child and the CASA didn't agree with me, yeah, that probably did happen. We shouldn't be agreeing. There should always be a point that we're disagreeing with somebody in a case because we're not the rubber stamp. Same goes for the child. We don't rubber stamp with the child once either. Safety always comes first in our recommendations. So I do want to point out, though, in every report that we make to the court as a best interest advocate, the direct wishes of the child, what the child says that they want, should always be included in that report. And that should be considered in that determination of what is best interest. That's a piece. That's always going to be a piece of what we consider. Now, the reason I bring this up, and I'm talking about best interest, you're going to hear me say that a lot, best interest advocacy, best interest advocacy. is because what we're really talking about when we start talking about attorneys for kids and advocacy, I think what's getting confused in this conversation are the models of advocacy, not just attorneys for kids, but the models. There's best interest advocacy and there's direct representation. So best interest advocacy is pulling all of those pieces together, all of those elements, and coming up with a recommendation that is in a child's best interest versus direct representation. And here's a slide about that. What does that mean? That means an attorney that is licensed by the Supreme Court who advocates for what the child directly says that the child wants. And that attorney would owe to that child the same professional responsibilities that they would owe to an adult client. And mainly, one of the main things that we're talking about in these types of cases would be confidentiality. So you might also hear stated interest, expressed interest, client directed. But that's really what we're talking about. So the client would say, I want to go home. I want to be out of residential. And the attorney acts as the child's megaphone. There might be some counseling involved, like, well, I don't really think the court's going to do that today. I think we might say this. But at the end of the day, if the child says, no, what I want to tell the judge is this, that's what the attorney's going to say. Whereas CASA might say, I understand that's what you want, and I will tell the judge that's what you want, but I don't think that's what's good for you today. Does that all make sense? Okay. So what we're really talking about are the models of representation. So I want to talk about what's happening right now, because I think some of this still has been muddled. So every child in Indiana in a CHINS or TPR is assigned a GAL CASA pursuant to federal and Indiana law. Also, GAL CASA programs are required to operate with access to counsel. That is pursuant to the to National CASA and to Indiana standards. Those attorneys represent the children's best interest. I was one of those attorneys. I served here in Marion County. I represented the local program here in Marion County. It was one of my favorite parts of my job. I got to go out and meet with kids and talk to them about post-adoption agreements and whether or not they agreed with the guardianship that I was filing for them, whether or not they agreed to the custody that I was filing for them, whether or not they were going to consent to an adoption. It was, like I said, it was one of my favorite parts of my job to go out and talk to these kids. They had access to me. I represented their best interests. That's a piece of the puzzle. The program here in Kids Voice, I brought Nicole Goodson with me who can answer questions about what Kids Voice looks like. They have a fleet of attorneys, is what I'll call it, staff attorneys that do just that. And it's in Marion County, and they have more resources here in Marion County to do those type of things. But what I'm proposing here is to create something that looks more like that across the state. So those attorneys, it's not just, I'm talking about Marion County, it's not just Marion County that has that. We have programs in the state that have attorney directors where the program is represented on every single case that is filed by an attorney. We have programs that have staff attorneys. We have programs with contract attorneys, pro bono, you name it. There is a program that I can tell you that looks like that. So just to let you know, this is happening out there. And there are programs that have attorneys that, frankly, I don't even know about. They call me and ask me a question, and I'm like, well, can you ask your attorney? And I'm thinking they're going to tell me they don't have one. And they're like, oh, yeah, well, I'll call him. Like, oh, okay. I didn't even know you had one. So more to talk about the current practice. Right now, as we stand here, the court has the ability to appoint a direct representation attorney for a child in a CHINS or a TPR. Often when that is happening right now, the party that's asking for that to happen is the GAL or CASA, and that's specifically for older children. We have a best practice that was created in 2018 for the GAL CASA network, and the reason that was created is because it was already happening and we needed some guidance within our network of when we should be asking for children to have an attorney appointed for them. And they're the cases that you would think of. If a child is a victim of human trafficking, if they're dual status, if they have a situation where there's a big conflict of interest, if they need attorney-client privileges, those kinds of things. We have guidance on when we should be asking for an attorney to be appointed to represent their direct interests. And that's happening right now in counties across the state. And children are having attorneys represent them on a case-by-case basis. There are cases where, frankly, our GAL CASAs, they're not following those best practices. There are other things that happen that I can't even think of. There are things that happen that I think I've seen it all. And then somebody calls me and they're right. That kid needs an attorney because this, and this happened, and good on you for making that call. So what do those attorneys look like? Again, it depends on where you're at. We have direct rep attorneys that contract with the GAL CASA program. And so the GAL CASA program hooks that child up with that direct rep attorney. We have public defenders that take those cases. We have pro bono attorneys that are doing the work. We have attorneys that are retained by the children's parents. We have attorneys that are designated by the court to do that work. So again, just looks different depending on where you're at. So I want to talk about the practice around the country, because I keep hearing about Indiana and how we're being compared to other states. And Indiana is doing this, Indiana isn't doing that. And in 2022, I spent several weeks putting together a chart of these states do this and these states do this. And what I was going for was to have two categories of like, these states provide these attorneys and these states do not. What I ended up with was about 7 categories. I do not recommend for anybody that's thinking about taking that on. And not only did I have like a chart with all of these different categories, each one had like a footnote of this, but not this, and then this, but not this. But what the conclusion that I came to is the majority of the states are using the best interest model, which is exactly what Indiana is doing. As of 2022, and I say this because things are shifting constantly by the day, but when I did this in 2022, there were approximately 10 states that had mandated direct representation for all children. And even in those states, the children who cannot articulate their wishes get substituted judgment, which is best interest advocacy. So talking about that, I know, we're Hoosiers. We've never been accused of doing things just because other states are doing it, but I still think that it's nice to see where do we stack up with other states. So I keep hearing Indiana's not doing this. We're not doing this well. Well, in 2021, we were 24th in time to permanency out of 52, and that includes DC and Puerto Rico. So we're right in the middle. I did see that Indiana and percentage of children that are reunified with their family, we were 4th. That's pretty amazing. I mean, that's a testament to the entire system, to families and PDs and judges and CASAs and DCS, all of us working together to make that happen. And then the other measures of success that we just saw recently from the federal review, we do a great job of making sure that siblings stay together, that they end up together, that they're placed with their family, with kinship, that they're having their educational needs met. So we really do have some strengths that we're doing, that good things happening in Indiana. Not to say that there's not room for improvement. I do understand that. But there are some good things happening. Now, saying that, all of that, there are some challenges do I think that we need to get more attorneys engaged with children? Sure, yes. How do we do that? I want to talk about the challenges that we've seen in other states. Children not being seen. That's been happening. Children not being seen by attorneys that are taking on cases and they're not trained in this area. There is some in the legal community, I don't know why, but there's some belief that this is not a very complicated area of the law, and it is the opposite of that. It's a very complicated area of the law. See, Judge Kenworthy agrees. Yes. Attorneys having caseloads that are unmanageable, and then professionals that are underpaid. Oh my gosh, I don't know where I got overpaid on that. Woo! We all wish, right? Underpaid and overworked and causing frequent turnover, and then a shortage of attorneys. So I did find this study, and this came out of California, and I have the link on here. I can send you this PowerPoint or this link if you email me. But so this is out of California, and this talked about that in these cases in California, dependency cases, that nearly 50% of the children that had attorneys had never met with their attorneys, and a significant number of these children didn't even know their attorneys' names. And what this study found is that having an attorney for these children that they did not know did more harm than good. And you can read the list of harms that were reported. So it's really important to do this, that it be done right. The last thing that we want to do is cause more harm to these already vulnerable children that are in these bad situations. So knowing this, that other states that are trying to do this already have had these challenges. And we're in Indiana, we know we have challenges that we're already facing. Here's a quote by Chief Justice. We currently have a critical shortage of lawyers, which is impacting access to justice in each of our 92 counties. We have a quote from Courtney Curtis of IPAC. The state has a shortage of attorneys, particularly the deputy prosecutor shortage, and it's becoming a public safety issue. And then from Justin Faulkner, hi Justin, 15 to 16,000 practicing attorneys in Indiana. And then I got some data from DCS. Last month, they had 16,224 children with open cases. So if we have 15 to 16,000 practicing attorneys in Indiana and 16,224 children in the system, as a practice, well, I don't practice these days, I'm in a different role, but I can tell you from my colleagues, there aren't a lot of attorneys out there clamoring to be in child welfare. So, public servants, when I was thinking about this and who we could get to do this work, public servants do not do this work for the money. We know that. They do this work for the passion, and that is all of us. It's prosecutors, public defenders, DCS attorneys, state government attorneys. If you say, okay, we're going to get attorneys to do this work because we're going to pay these people to represent these kids, well, now you've just cleared out the public defender's office or the prosecutor's office. We're all the same. So I don't know where we're going to get these attorneys. And I say that to say, not to be discouraging, but just to say we have limited resources. How can we take what we have and do the best job that we can with what we've got? So I'm just trying to think of, what do we have? What can we build on? We have one of the largest established statewide GAL CASA networks in the country. That's a fact. How can we build on what we have? Well, we can build on the network that we have. We can increase access to attorneys for our CASA network, give those programs attorneys, get those cases as they come in the door, get attorney hands on those cases. Kids Voice has a model. When those cases come in the door, even if an attorney doesn't work on that case because it seems like it's going to be simple and not as challenging, an attorney screens that to make sure the second that it comes in the door. So there are legal eyes on it. And that's how it would work. The cases that are less challenging, we have cases come in, this is a dirty house. This family needs this house cleaned up. It's a problem right now, but it's going to be taken care of. These kids need to get to school. It's been a problem. We haven't been able to get them to school, but we know this case isn't going to go on. It needs to be cleaned up. This family came in because of substance use disorder, but these parents are motivated. They're in treatment. We know this looks like it's headed in the right direction. And then we have other cases that come in. This is a repeat family. Or this kid is high acuity. We don't think this kid is going to be easy to place. That looks like we're going to need an attorney on this from the get-go. And the way that also helps, we have an attorney on that from the jump, because we've got a best interest attorney that came in and said, all right, I know right from the beginning I need to be on this. That is so much better than identifying 2 years down the road that this case is a problem. CASA needs to go out in the community and find an attorney 2 years into a case. So cases with less, we don't have the attorneys to do it. This case doesn't need that much intervention. Then we can let that go and focus on the one that does. So saying that, okay, best interest attorneys, Ray, so how is that going to actually do anything? Well, there's a lot of things that best interest attorneys can do. Petition for a guardianship to expedite permanency. Kids placed with grandma. We're just sitting around, everybody's twiddling their thumbs, waiting for someone to file a guardianship. Grandma doesn't have the money to hire an attorney. Well, file a guardianship. The program can file a guardianship on behalf of the child. File a petition to modify custody. Get mom or dad custody and get this case closed. That's all we're waiting on. This case has been sitting ripe for TPR. Nobody's willing to file it. Let the program file it. Let's be done with this. It's time. This kid is getting ready to age out, and we don't think this child's going to be able to take care of themselves in adulthood. Let the program file an adult guardianship. We've got issues going on in the adoption. This is getting wonky. Let the program intervene in adoption on behalf of the child. And the list goes on and on and on. I've done all kinds of things. I've been to expulsion hearings. I've done name changes. I'm trying to even think. There are things that I wouldn't even think that I would have done. I had no idea I'd get asked to do. And frankly, it's a little scary. And you're like, I'm not sure I know how to do this, but here we go. But that's just kind of what you do when you're a best interest attorney. If it calls for it and that's what's needed, and it's in the best interest of the child, that's what you go do when you're part of CASA's team. And beyond that, it is a fact, if you involve more best interest attorneys for CASA, we're going to have more direct rep attorneys coming in because the CASA attorneys identify it. And how are we going to identify it? We have a best practice. Kids that are victims of human trafficking, I don't think you're going to talk to a CASA that would tell you that that kid doesn't need an attorney. That kid needs an attorney. A kid that's dual status, JD and CHINS, juvenile delinquency and a CHINS case, that kid needs an attorney. I don't think you're going to talk to a CASA that's going to tell you different. Significant conflict between best interest and child's wishes, and I do say significant conflict because there's some nuance there. That kid needs an attorney. Attorney-client privilege, maybe there's something that's gone on in the home, there's potential for a juvenile delinquency. Let's get that kid an attorney. And then we have other screening tools. We have a tool within our CASA network that we use. Is that child older? And we've done one of our wellness assessment, and it's looking that there are higher risks. Why don't we go ahead and get work on getting that child an attorney too? So just some things that I was thinking about of how do we take the limited resources that we have and apply those in the most efficient and cost-effective manner, and not just cost-effective, but with, just the number of attorneys that we have. So the other issue, just real quick, the training issue. We have to make sure that these folks that are going to do this are trained. Right now, an attorney that wants to come in and serve has to have training to be a part of GAL CASA, and that's in identification and treatment of abuse and neglect, and then the early childhood, child and adolescent development. And right now, for direct representation, there is no requirement for training. The state office of GAL CASA has put together a 4-hour curriculum for direct representation, and I would be happy to continue. I've done that, gone out in the community and delivered that training. I would be happy to continue to deliver that training, and that would be in addition to any training that the local program would like to deliver. And just the way that I see this is we could have a holistic approach: CASA program, CASA attorney, direct representation attorney, public defender, family, a DCS, and just everybody wrapping around the child would be the goal. So that's my contact information. I know everybody gives that at the end of a presentation. I legitimately mean it. Please contact me if you have questions. I really appreciate your time, and you come and let me and spill my idea here in front of you. So thank you.
Thank you so much. I think we're going to have some questions, Representative.
Yeah, thank you for that presentation. A couple of comments and maybe a suggestion, and I know we've been looking at this for the last several years. Senator Ford, John Ford, before he left the Senate, had a couple kind of summit conferences at the Indiana Law School and got into a deeper dive with this, and it felt like there was a major urgency that we had to have these representation. And we're one of 7 states or whatever it is, 13 states maybe, that don't have attorney representation. So we're just trying to get a feel for it a little better. But do you have data? So you're giving a recommendation as a CASA to the judge, right?
I'll be talking to the Chief Justice about this for, an internal.
Well, when your typical CASA workers are in a courtroom with the child or trying to advocate for a child, right? And they're giving a recommendation. Do you have a data that says the judge uses that recommendation, or do we have that information to say, are you really effective, right? Are these CASAs and earning light items real effective?
So I think we would have to do a survey of the judges. I can speak anecdotally. I think that the CASAs are very effective. I don't think that I don't want to put words in anyone's mouth, but I think that probably DCS would agree with that. I think the public defenders would probably agree with the CASA recommend. They may not agree with the CASA recommendations, but I believe that they probably would agree that that the judges listen to the CASA recommendations.
And the judges are an attorney, right? And they got the best interest, I would assume, for the heart, right, Your Honor?
Absolutely.
And I know right now attorneys are hard to come by, right? Which some people, it may not be a bad thing, but right. And I know when DCS started, they had privatized attorneys, right? And now we have in-house attorneys, and now there was a bill 2 years ago from Senator in the Senate chambers that was trying to go back to doing private attorneys, which again are harder to find and more expensive. And I guess we do really truly want it the best interest for the child. In and I guess that's a question for DCS, to our in-house attorneys. It seems like they were getting some kids right out of college, right? So were they getting the best attorneys? Is that critical? So I guess it seemed like we need to do a little overview, a better overview of the true need that we might have. But thank you for your presentation. And
You bet. Oh, go ahead, Joel. Yeah.
Okay, sure. So I wanted to share a little bit about myself at this opportunity because I'm a youth representative here. I was appointed a CASA. I was appointed an attorney. My mom had an attorney, of course. And so some of the things that you said, I just found really, really interesting. I speak at CASA panels. I do CASA community events, which is like inspirational speaking about my own story because my CASA was like the rock star in my case, and I never spoke to my attorney. But with that being said, I also am a proponent of NACC for Counsel for Children because, like American Bar Association recommends that every child does have an attorney. We are one of 13 states who do not in America. So I just had a couple of questions for you because one of the things you said that struck me the most was when you said that the CASA was a representation of the child's best interest and not the child's voice, which I know in my case, that was not the case. My CASA recommended what I wanted to the judge. And I remember that was the most monumental thing because I was an older foster youth and she propelled my voice to the judge, which helped the judge understand what I wanted because DCS represented my best interest. Even if it wasn't what I wanted, my mom's lawyer represented what my mom wanted and my CASA represented what I wanted. And so it was a great chance for a youth's voice to be propelled in court, especially considering CASAs are volunteers. And even though they go through extensive training, they're not attorneys. And so I thought that was really interesting. And so my first question was, especially because I do CASA events, and I think that that's a very mixed opinion on the ground floor of what a CASA's role is. So my first question was how you're propelling that message of their representation to the actual CASAs.
So a CASA should always say exactly what the child wants. And I don't know the specific facts, but if I had to wager a guess, I would guess that your CASA probably figured that what you thought was in your best interest.
Right, and I would agree with that. But I remember, and currently my involvement in the CASA program, like she helped me write court reports to the judge. She helped me do all of those things to propel my personal advocacy within my own case. And I think that there's a lot of research to also back up propelling youth voices, which is direct representation. And so then my second question for you was where you mentioned like the special cases for victims of human trafficking, juvenile delinquent cases. And so specifically for juvenile delinquent cases, since they are entitled to the right to an attorney in Indiana, would that mean with their involvement with CASA, they would get two, or would it just be the same one that they're entitled to?
So they do have an attorney on the JD side. I'm sorry, on the delinquency side, I use acronyms like they just come out on the juvenile delinquency side, but sometimes they don't have an attorney that's also on the CHIN side of things. And that can be the same attorney. Sometimes that attorney does have crossover expertise, but sometimes they don't. And sometimes it would be two attorneys. It depends on the circumstances.
Okay, great, thank you.
Go ahead, Jim.
So, I had a question about what we do to support the mental health of the CASA or GAL themselves. I remember I've done a couple of these cases, way back in the day as a baby lawyer. Was not in any way prepared to do it, but I did anyway. And they're just, they're heavy, right? And so, and I also remember recruiting pro bono lawyers for work when I was in Indiana Legal Services. And it's really easy to get somebody for like a probate, fair where you're doing simple wills for people. It's a lot harder to find somebody to go to eviction court, for example, to represent somebody. But it's probably similar here. So, for example, with our 988 call center, we do debriefings for the after any sort of tough case, right? For mobile crisis, similar, like a debriefing or access to services to deal with that vicarious trauma. So I'm just wondering if there's anything you have or have considered.
You know, honestly, we probably don't do enough, and I wish that we did more. We do have, for our directors, we do have Casa Cafe that we do once a month, and that's where we give them time to come together and they can talk about whatever they want and kind of relate to each other and just kind of blow off steam if they need to. We do have a spring directors meeting where they can kind of do the same thing. We try to give them space to do that at the conference, all the way down from director, all the way down to volunteer. We do a lot of sessions on self-care and secondary trauma, and because you're right, it's heavy. And we do encourage each program to have each program has a crisis management plan and to have therapeutic services available because things happen on cases and they need to have that on hand and ready to go.
So just a couple things. First, I want to shout out the actual CASAs themselves. It showed the 16,224 kids, I think, under care. My last report that I saw showed 2,800 some CASAs covering those kids around the state. So if you think of attorney caseloads and CASA caseloads, those are both things that we worry about. If you're in the State House ever and you've not seen CASA Day, where we get all of the blue shirts that come in and fill that bottom atrium, it is quite a tremendous experience. And they're doing it, other than the staff folks working those programs, for free, because they love taking care of and representing kids. And I love hearing that sort of story. The Chief Justice and I have had a number of conversations with Senator Ford when he was still here, and then also at the national level in response to the ABA's push for lawyers for all kids. And we've been consistent that the right kids and the right cases absolutely not only need a lawyer, but that lawyer makes the case go better for the kid. And that's the guidance and the model that the CASA programs currently use. We've also been pretty consistent that the one-size-fits-all model creates as many problems as it might solve. When you talk about adding a lawyer for a child who cannot direct their representation, or you've got a case where there's maybe 4 kids and their interests don't align, you then have potentially a lawyer for each one, plus a PD for the parents, or each parent, plus the DCS attorney, plus the CASA program attorney. We're in the bottom 10 in terms of attorneys per population as a state. So we can't get there, even if that were the best idea. But what they're talking about doing is applying our current model. The judges are following. When someone says this kid needs a lawyer for this case and this particular child, they're willing to reach out and have one appointed, making sure that in those rural counties where we're really desperately short qualified, trained lawyers, we have a good network that they can reach out to us and we can plug the right lawyer into that case, because it is incredibly complicated. So it's a big issue, and we're fully on board with making sure that the right kids have lawyers. Every kid is just overly simplistic and not as effective. So we're always willing to have conversations about where those lines should be, what the age parameters, what the case parameters should be. All those things I think are stuff that we should talk about as we go forward.
Oh, sorry, Judge.
I will echo some of what Justin said, and that is that the shortage is real. I mean, even if you have 70 attorneys in a county, 6 of those might be comfortable representing children, and that's a very realistic estimate of that. The other issue is the cost of these programs. So CASA programs, each year I was able to go before my county council and say, this program CASA costs about 5% of what it would cost to pay a GAL attorney for each of these children, even at a reduced rate of $80 an hour, which is very low for an attorney. So it's a very cost-effective program. These CASAs spend hours and hours on these cases. I mean, they truly dedicate their time and energy and heart to these kids, and that's what we see. So someone asked about the data or the effectiveness of CASA recommendations. I can tell you that every single time I received a report, I read every word, and I took every word seriously. And I think that's very characteristic across the state. I would also point out that training is super important because children's cases are very complicated. And then the other concern for me is a very pragmatic concern, and that is if we are adding 1 more attorney, 4 more attorneys to a case, that case is going to bog down and be delayed because we cannot find a time that matches for every attorney's calendar. I mean, that is very realistic. And so we are trying to shorten permanency timelines for children. And I fear that this would do exactly the opposite. So I view this proposal as a strategic way to use limited resources. And I think it's a very positive step in the right direction.
Do we see a correlation between the states that have mandated direct representation and time to permanency for those that don't? I mean, is it pretty, I mean,
I'm sure we could find that
yeah.
data.
I mean, obviously
I
ours
can tell
is,
you what it is
as you mentioned,
today.
Yeah,
we're doing pretty well.
Yeah,
but,
we're right in the
it's
middle of the
not-
pack.
It's just one model. Just to talk about where this is in the process, this is something that's still before, still has yet to be sort of decided, because this would just be a new implementation that I guess the courts would make a decision on. What's the process there
so
for
it-
implementing this? Because I agree, it does appear to be strategic within our resources and our model to sort of advance the ball.
It's already under our guidelines, and the programs are already following the guidelines that she talked about, dual status, chin 6, over 14, that sort of parameters. This presentation, this proposal to do the networking and coordination, we're going to run to the chief probably in a couple weeks for her approval and then get it moving. So.
Go ahead.
I just had a quick question. So I had a GAL and an attorney, and they were both amazing. But my question is, my GAL had, I guess, the knowledge of a court therapy dog service, and so that was utilized in my case, and it was, again, a very incredible resource to have. But I'm curious what tool exists for them as like a CASA or GAL to like have the knowledge of those things out there, or are they just relying on their own like personal experience to provide that?
The court therapy dog?
Yeah, like if she hadn't known about that, where would she have gone to, I guess? Yeah.
So there are certain trainers across the country that do that. They really do have to seek that out, usually on their own. It depends on, frankly, our programs are overseen locally. So the judge would have to be on board with that and make sure that's something that they want to do, and they'd have to seek that out on their own to make sure. Yeah, I probably know which county you're talking about.
That's an interesting example, because so you had a CASA and an attorney concurrently. This is
Yes.
my own naivete. So that's, yeah, you did as well, right? Okay. Throughout your entire case, right? Yeah.
Well, thank you
Ray,
so much.
thank you. We look forward to sort of an update on, I guess, via Justin or yourself. On sort of, oh, go ahead, Bernice.
I'm super sorry. I just
No.
wanted to respond to a question that was asked about wellness or mental health support for CASAs. I did want to offer the Public Defender Council has created a wellness program that we've done around the state for defenders. We've also done it for DCS, but we also did it for CASAs as well, and it was really well received.
Thank you.
Okay,
Ray.
thank you.
Yeah. Mark Fairchild, you have some updates for us.
All right. In the interest of knowing my own lack of brevity, I'll just present from my seat here. Maybe they'll keep me in check. Just a few items on my list. There's a lot that we've covered already today, and I really appreciate our presenters coming in. I think it gives us a good tone of some areas to look at moving forward into the next legislative session, and just overall about the supports we're trying to wrap around families and youth in care. I did want to point out, I will not go through it word by word, but our newest annual report just got released as about 4 p.m. yesterday. It is electronically available on our website. So that's just in.gov/children. You'll see, and Blaine will flip through it just as I'm talking briefly here. You'll see we really went with a very narrative approach. So in the past, it has been a lot of this many recommendations on this model and this platform going forward. We try to be a little bit more descriptive about who we are, what we do, and how we do it this time. So the annual report can really be a storytelling guide, especially if you want people to learn about the commission. We want to be a good place where you have something that you can point them to. And we will have print copies in the next meeting too, if you're somebody that likes to hand those out personally as well. But talking about what happens at a meeting, what kinds of discussions we have, but also what our individual members do. how our youth are engaged in programs that we attach ourselves to. Things like the Best Youth Initiative, all of our family engagement work that we've done around the state, presentations that we give. So again, much more giving that context. We've heard a lot of people saying that, they look at our website and they look at our materials and they still have to ask me, well, what do you do? So that means we're not telling our story the right way. So just trying to, again, provide another tool to be able to do that. And you'll have some great quotes about the experiences of our current youth representatives in there as well, and their contributions. And of course, having some of the information on our task force membership and everything going forward. So look at that. We'll have paper copies of the next one. I won't read through it because I know we're getting close to our time here, and I hate to keep people late as much as I do love to talk a little bit. So beyond that, I did want to point back to the Best Youth Initiative that Allie presented on. We did have a great time in DC, and we have a wonderful team there. But the team that went to DC is kind of just a sampling of all the people that are going to be involved across the state of Indiana. Right now, I have about 20 people from different agencies, other lived experience individuals. We have a parent attached on it as well. This working with one of the schools actually doing really good work on chronic absenteeism, so shout out. And there's a lot more coming with that you'll be hearing, particularly be watching September 23, 24, and 25. The folks from the Forum for Youth Investment that are doing our technical support and consultation work are coming to town. We've reserved some space here over at the Office of Court Services where they want to do some key informant interviews. So I'll be putting out a note to the full commission saying, hey, if you want to take part in that, and if you want to have half an hour with them to talk about that issue, as well as the youth and family engagement work that really surrounds the entirety of the initiative. They would love to talk to you. They'll be here, they'll be in person. So for government center folks, they'll have some slots here, they'll have some slots over by the courts as well. So if you see that from me, do feel free to add that. Or if you're aware of somebody who's working on either the family and youth engagement piece or chronic absenteeism that might not already be a part of our discussions, definitely make that connection for me, and we'll see if they can be joining those conversations as we go forward. Again, it is a 3-year initiative. I love it when there's an initiative that gives us enough time to actually not just come up with a quick fix and work things through, but we want to, from the start, really keep the momentum going we've had there. I also want to shout out to the Indiana Youth Advisory Board that DMHA and the Department of Health work so well with us on. Because when we had the application going together for Best Youth and we had to find some lived experience folks very, very quickly, they immediately put out that information and found some exceptional young adults for us to work with that really just blew us away during the trip. And of course, Allie being a part of that as well. So we look at continuing that relationship as we grow that, but tremendous work happening with that group going forward. Also on my list, we have in our audience today our first cohort of Gene Bro Collaboration Fellows. So if you remember, we voted to expand our internship program into a full fellowship program. So that is a paid placement. We have 2 students from the IU School of Social Work here with us today. So Alyssa and Peyton, you can rise and wave without being on camera. So you're in a safe spot in the audience. So also by being able to have 2 of them, we'll be doing a little divide and conquer. So Alyssa will be working a lot with our family and youth engagement side, and Peyton will be working more on the policy side and helping me stake out the State House and all that good stuff during session as well. So more capacity, more places for us to be as we're trying to grow in a lot of those spaces there. So happy to have them on board, and I'm sure they'll do a great honor to Senator Bro's legacy there as well. All right, and continuing my fast talking, but making sure I had a couple of minutes for a tiny pitch at the end here. I did want to start planting the seed that we've had a ton of growth just in the short time I've been with the commission here. And we've done some wonderful things. And I can't emphasize enough how grateful we are for that. A lot of that comes from funding from the General Assembly that allowed us to, of course, maintain my position, but bring in Blaine. Add a half-time admin staff with our other Peyton back there doing work at the desk, being able to add a little bit more youth and family representation on our different task forces as we go into that. Of course, expanding our program so we now can have 2 students working on us instead of just 1. And with that, we've been able to go into a lot of new places and a lot of good directions, right? So we're talking about the Best Youth Initiative, our family and youth engagement work as we've expanded that out and grown there, getting more voices from the people that are directly served by the state agencies, directly on our commission, and then on the task force and supporting what we do. So it's been tremendous to see. I do have to note that with that growth has definitely come a need to continue growing. So I will be going into a little bit more detail in the next meeting, but I would like to propose that we start looking towards a second coordinator position that will specialize in family and youth engagement and community engagement work. Blaine does an exceptional job on both. I prefer he not have a stroke before he's 30, and he's doing tremendous work there. But we know that it's becoming where it's splitting attention in a few too many directions. We want to do really good by our task force and all the volunteers we have there. Again, several hundred people involved in that. That Blaine helps to support every day. And then with our family and youth engagement and the new task force that's going to have even more of that, there's a specialization that's needed there. Meetings after hours, additional levels of support. They don't have all the state agency supports we have. They don't have peers that are down the hall that they can ask for the expertise and everything. So they need a whole nother layer for us to utilize what they bring to the table correctly. So looking at splitting that role into task force support and then that engagement level support, I think it's going to be really essential in the very near future if we want to keep doing it at the high level of quality we need to. Also noting that there's so many state agencies that are doing good work with people with lived experience right now, Youth Advisory Board being one great sampling of that. We want to make sure the commission's able to help coordinate and support that the way we do with all of our state level agency work. And dedicated staffing is really the best way to make sure we do that as well as we possibly can. So you'll be looking for, with the next budget, I'll be requesting an increase of approximately 85 to 100,000 to bring in another coordinator position. Our current allocation of 350,000, we've worked very well with that to do a lot of expansion in a lot of ways that we're quite proud of. But it is time to say if we want to go to that next level and continue doing what we're doing, grow into the areas that we've talked about today, we'll need additional level of support to do that in the best way possible. So that's my preview ask on that. Next meeting will be where we're talking more about formal legislative proposals that we want to consider going forward, but that's what I'll be having from the commission this time around. So,
in our, thank you, Mark. I think our next meeting is the 16th, is that right? Okay, great. Any other announcements, discussion points, questions? Great, we're adjourned. Thank you.